Houston is rolling out a bold new tool aimed at changing how we understand and tackle gun violence. SAFEWatch Houston, launched by Abbie, Kamin, City Council member for District C, is the nation's first dashboard to merge hospital trauma data, emergency response records, and police reports into a single public-facing database. The goal? To give residents, policymakers, and public health officials a clear, data-driven view of who's being hurt, where, and why. From shootings that are reported to police to injuries that never make it into crime logs. Joining us now in studio to walk through what SAFEWatch is showing and what it could mean for Houston's approach to gun violence prevention is Council Member Abbie Kamin. Abbie, good morning. Welcome to Hello Houston in studio for the first time.
It's great to be here.
Well, folks have a question for you. They can certainly call us at 713-440-8870. All right, explain SAFEWatch to me.
Yeah, so a lot of people don't realize we know how many firearm deaths related to firearms there are in our nation. Mm-hmm. But what most people don't realize is we don't actually know how many injuries there are. We don't have that data. And that's surprising to a lot of people, so it's important to say that.
Why don't we? Is it not reported by ERs or just people don't go to the ER?
Everyone's going to the ER. It's not being captured in crime statistics necessarily. They're not being reported to HPD, for example. What the data now shows that we have, and I'm happy to explain that, we saw a 70% gap between when we look at crime statistics, which as a council member, you're poring over crime data, right? Trying to create prevention and intervention strategies. 70% are going to the ER or being rushed to a trauma center, and we never know about it. It's been this invisible health crisis, an invisible epidemic. And as a mom, I think about when you put your child to bed, there are so many families, including in Houston, that are putting their kids to bed not realizing what can happen to their child the next day.
Before we get into the nuts and bolts of it all, I'm just curious, why do you think that gap even existed? Why were we not? How did we miss all of this data for all of this time? And what opened your eyes to say, look at this, we need to know these numbers because it impacts everything we do moving forward?
Yeah, well, and look, last segment we were talking about doctors and the importance of the medical community. It was the medical community that opened my eyes to all of this. But the reason we don't have a lot of this is for a long time under federal law, the Dickey Amendment in the 90s, we were not seeing the funding, and there was a hesitancy to actually look at all of this comprehensively. That's all changing now. And what we do know is that firearms are the #1 killer of children in the United States. And when our trauma surgeons are seeing every single day a child being rushed in because of this, they're saying we need help. And what we were told is that what is needed is this type of data, this dashboard. And it's important that it's publicly accessible because, yes, the medical community can harness this and utilize this the same way we've done with car crashes, the same way we've done with pool drownings and strokes and diabetes. But it's also available to the public because every single one of us can be doing something to prevent tragedy from occurring.
So what have we found out with SAFEWatch?
Yeah, so what we're seeing in addition to this massive gap in reporting is that tragically unintentional shootings, which is what I'm really focused on, unintentional shootings of children is silently increasing. Last year alone, over half of all unintentional shootings were children and young adults under the age of 24. And what that number added up to was at least one child rushed to a trauma center every single week here in Houston.
So not really gun violence, just gun misappropriation, gun accidents.
Accidents. Yeah. You think, look, we do firearm safety education in District C, and we want to broaden that throughout the city now because of the data that we're seeing. But we do free gun lock and gun safe distributions. We've been at elementary schools where we say, hey, do you have a firearm in the home? And the mom has literally said, no, we don't have a firearm. Then we say, well, do you have a family member that has a firearm? And the mom said, no, we don't have a family member. And the little girl pulled on mom's shirt and said, no, mommy, grandpa has a gun and it's under the bed.
Wow.
And more often than not, I don't have the numbers in front of me, but more often than not, a child knows where a firearm is stored in the home and has handled that firearm without the parent's knowledge. No parent, no grandparent, no friend wants the unthinkable to happen, but it's happening. So this is about education. This isn't politics. This is prevention. And every single one of us can do that. Especially, I want to remind listeners, over the holidays, we see an uptick. Kids are home, you're visiting family, you're dropping friends, kids off at a friend's home. The awareness matters, and that's why this dashboard matters.
So explain a little bit about what you do with this data. Once you see these problems that a lot of us have suspected are out there, but now you've got numbers behind it, how does that turn into the future for us?
Yeah, so evidence-based interventions, and that's a fancy way of saying when you have evidence, you can create interventions, health-based interventions. And that can decrease unintentional injuries 30 to 50% in other scenarios. So when experts can now go work with pediatricians when you talk about pediatric screening. So like when I delivered my son at the hospital, they talk about how to install the car seat safely, right? That same type of education, if we're working with pediatricians, if doctors are looking at this, and also as a community, we're focused on things that the data is showing. For example, we can break things down, and I want to emphasize it's all HIPAA protected, data is scrubbed. This is just looking at the numbers, not sensitive information, but we can break it down by zip code.
Well, to that end, Charlie Parker on YouTube says you would have to work with hospitals to get the data pulled from the hospital's emergency rooms. Is that true?
Yes.
And in that light, but you're not pulling anything that is HIPAA protected.
No, and that is why it's taken us 3 years of hard work to get this together. And I want to look, we are home. Houston is home to the largest medical center in the world. We have all of this at our hands, but we had to bring everyone together. We had to be working with our trauma centers. So we have UT Health, Memorial Hermann, Texas Children's, and Ben Taub, all working together now and sharing this information with the city. This is a hub that's collecting HPD, EMS and 911 calls, medical examiner, ER data from throughout the area. But then our level 1 trauma centers are really what brought all of this home.
So I guess it's to make us aware, more so than we realize, that this is a big problem, and therefore we could be more inclined to do something about it.
Almost phrase it as we learn, we can react. Right?
Yeah, and what I'll use the example of strokes.
Yeah.
So it is very standard for the city of Houston to monitor things like strokes.
Why?
That way,
why do we monitor that?
Because then we can say, oh, we're seeing a higher concentration here. We need more education in this part of town. And we need to position our mobile stroke units to respond faster to a larger portion. It's the same type of thing here when we can go in and say, oh, for children, we're seeing unintentional shootings in these zip codes at a higher rate. We need to be reaching those families more. It may be more, for example, on the tragedy of suicide with a firearm. That may be a more kind of suburban area, and you're seeing older white men. And okay, that's a different type of crisis intervention that we need to be working on. So this allows us to take steps to save lives in a very meaningful, impactful way. But I want to go back to the doctors. Okay. When doctors say this is what we need, we've got to listen to the doctors. And we've got to do everything that we can to save lives.
What about some of the critics that say it stigmatizes particular neighborhoods or particular populations, and that it could have an inverse reaction, a negative reaction to how we view parts of our community?
Yeah, I think that it's a it's a valid question.
Yeah.
But the data may show, okay, a family in this zip code, there's more families being impacted, but that doesn't necessarily mean that's where the unintentional shootings are happening. And you can also look at that. So just because there may be a focus on, hey, this area has a higher rate of families being impacted, that doesn't mean that's where a shooting is occurring. So we have to make sure that we're not that we're looking at the facts and just the facts and not reading more into something to save the lives of our children.
We have a number of good questions here. First of all, at what point, if ever, is a hospital required to report a gunshot wound?
I don't know the exact answer to that. And I would want to defer to our medical community, to the doctors, because again, you want patients to show up for treatment. You want patients to trust doctors and know that they are not necessarily going to be involving law enforcement if that's going to prevent them from getting the health care they need. But if there's a crime involved, that's also critical information. So I'm not going to answer that. I would defer to the medical community about what their policies are.
Okay, we have one from District C. I live in District C and have seen no, all caps, no gun safety programs.
Please reach out to our office at districtc@houstontx.gov. We have been throughout the district. Our focus has been on schools and community events. So we work with PTOs. We work in the community at actually Freedom Over Texas, our 4th of July, big city celebration. We partner with HPD. All of this started in partnership with HPD through a campaign we called Lock It Up Safe. And so we've been throughout the district. And if you're interested, if anyone is interested, not just in getting a gun lock or a gun safe for free, but you would like us to come in with our partners at HPD or with the medical community, other organizations, we would be more than happy to work with you on that.
Here's another, and this does seem to make sense. Is it possible the rise in gun accidents correlates to the removal of all gun control and licensing requirements?
There likely could be. I want to emphasize this isn't about gun control. This is about firearm safety. And we have been working with organizations that have that are firearm rights advocate groups that still want to emphasize responsible gun ownership. So yes, I would say that Texas has some of the higher rates, but we also, again, in terms of walking blind right now, we don't know what other cities' data really is because nothing like this exists. This is the first, most comprehensive dashboard of its kind in the nation.
What about drug overdoses? You said strokes, like we need to educate these people, obviously with gun safety. Do they must record when someone comes in and they're overdosing on drugs? And can you narrow down zip codes where we're seeing more drug use or drug abuse?
I can't speak to that specifically. I know that hospitals are absolutely tracking. I will say on this dashboard in particular, there's actually with certain data, not every tab includes everything because we're still trying to make everything uniform. But on some of the tabs, for example, with trauma center visits, with the firearm injury dashboard, it can show if there was alcohol or narcotics involved.
I want to remind everyone we are talking to City Council member Abbie Kamin. And Abbie, also, let me give a phone number, 713-440-8870. Folks want to join in the conversation. To go back to the dashboard, the mayor, and I'm going to misquote him a little bit, but the general gist was, hey, it's a great idea, but is it worth the money?
It absolutely is worth the money. And it's a little surprising to hear. I hadn't heard that, but the mayor questioning things when it was his administration that we worked with and that authorized the funding for this. And they have been incredible partners. I want to say that, both Mayor Turner's administration and the Whitmire administration. When you look at what gun violence costs us as a nation, it's over $500 million every year. Every single day, that breaks down to over $7 million. One firearm injury costs taxpayers, employers, the families over $25,000.
Wow.
So if we talk about the cost, absolutely, and a dashboard like this is sustainable. It's not an increasing cost. It's the standard things that the city of Houston does with other like I said, other types of health-based needs that we track. But I want to make sure we're bringing it back to the fact that this is saving lives, and you cannot put a price on the life of a child.
How exactly is it saving lives? Just through education?
Through education, through intervention, through awareness. But again, it's the actions that we are now able to take because we have this information. We are not walking blind trying to address something without getting the whole picture.
Well, one comment says that nurses and doctors know what is happening, and we've been asking for help, begging for help. So it sounds like they're all on board.
They have all been on board. They have been incredible partners. They were the inspiration, in addition to the fact that I am so sick and tired of seeing headline after headline of a child that got a hold of a firearm and either lost their life or hurt someone else. And we, again, can do something about that. And we are doing something about that. And Houston's leading the way, but this is a blueprint that the rest of the country can use.
Yeah. Talk to me a little about reframing gun violence as a public health issue as opposed to a crime statistic.
Yeah. For far too long, politics have gotten in the way of us taking action. When gun violence is the leading cause of death for children in the United States, that is something we must act on with urgency. It's the same thing that we did when car crashes were the leading cause of death. Mm-hmm. So why should this be any different when it's about saving children's lives and when this is about our families? Because again, I think about, as a Houstonian, what it's like when your child is the one being rushed to a trauma center and there's a family every single week going through that nightmare.
Absolutely.
Can we access SafeWatch yet?
Yes. Thank you for asking the question. You can go to houstonhealth.org/SafeWatch. So again, houstonhealth.org/SafeWatch. It's publicly available information. It's for everyone to use. Anyone can reach out to our office as well.
We have 2 minutes.
Yeah,
You have a future that's going to change. You're going to leave city council and run for Harris County attorney?
I am. This was a difficult decision, right? But I honestly couldn't take it anymore. Seeing the constant attacks from President Trump on our families, the attacks that Greg Abbott and Ken Paxton are bringing against just local authority, I really looked at, after this position came open, how I can make the biggest difference possible and be in this fight in a bigger way. And it has been an honor representing District C. As county attorney, I will be able to not only continue to represent the people that I work with every single day in the district, but our entire city and the county.
So Chris Menifee has resigned the position. He's just held over for now. So what happens? What happens now? Special election?
Yes. So the city and the county are working through that. There's a lot of different laws and rules and regulations that dictate when you cannot have a special election, but there will be a special election for District C. And that as soon as we know what that date is, we'll be making sure that we're pushing that out.
So really quickly then, so do you stay in this position for how long up until until there's a date set or until the election? How long do you remain where you're at?
I will continue to fight every single day for District C. On the way over, we were working on an apartment fire and resettling and relocating, working with the Red Cross for our residents that are the most desperately in need right now. So we'll continue that until someone else is elected as the next council member for District C.
All right. Council member Abbie Kamin, it's a pleasure. Thanks for taking the time to come into the studio today.
Thank you all, and I want to remind everyone, holidays is an important time. Make sure your firearms are stored securely. When you're going to family and friends' homes, ask those questions. No judgment. We're here to help.
And check out SafeWatch.
Check out
SafeWatch.
SafeWatch.
It's fascinating.
Thank you.